Lawmakers take another step in breaking up health insurance monopolies in the name of providing more choice and cutting costs. The House Judiciary Committee voted to curb the industry's limited exemption from federal antitrust laws. The American Medical Association weighed in, saying that in 10 states, the two largest health insurers control at least 80% of the market. The House committee says the bill would stop price fixing and other abusive practices. With me now, Congressman Anthony Weiner, who serves on the House Judiciary Committee, and Robert Zirkelbach. He's the press secretary for America's Health Insurance Plans. Anthony, I'm going to start with you. Representative Weiner, you got 3 Republicans to cross party lines vote with you. What's the message that you want your committee to send to the insurance industry, and what do the Republicans who didn't vote with you have to say?
Well, I don't know how someone could vote against a bill that would say to the insurance industry you can't price fix. I mean, that seems to be pretty much common sense. Look, frankly, the health insurance industry is governed state by state, something they complain about some days and embrace other days because of a quirk in the law. There's really no reason they should be that way. It's clearly interstate commerce, and we just want to make sure that they're not essentially rigging the books here and rigging bids to conspire and fix prices. But the larger problem is the health insurance industry themselves. They don't want any change in the status quo, because just as we all suffer from the status quo, they benefit.
Robert, you said that this is a remedy for a problem that doesn't exist, but if it doesn't exist, why do you care?
The legal analyst, including the Congressional Research Service, has said that price fixing, competition, those issues do not fall under the purview of McCarran-Ferguson. This act simply affirms that health insurance is regulated at the state level. The health insurance industry is one of the most heavily regulated industries in America, at both the federal and the state level. And what we should be focusing on right now is what we can do to make health care coverage more affordable, how we can get everybody covered, and unfortunately, we are trying to spend all this time trying to solve a problem that doesn't exist.
And Representative Weiner, if that's the case, it's hard to understand why even the AMA has come out and said that 90% of the insurance market is too heavily concentrated with sometimes just 1 or 2 choices.
Well, the fact of the matter is the insurance industry doesn't compete based on price. If you think it's just me saying that, ask anyone who's 55, 56, 57 years old who goes out into the private insurance market and tries to get a quote. They'll find that they're all uniformly, very closely bunched up and very high. The problem is simply this, is that we have decided as a country to have an experiment. We're going to have Medicare, public system that has very low overhead, doesn't take profits, and a private model that takes a lot of overhead, a lot of profits, and pays the salaries of people like Robert. What we in Congress are wrestling with now is how we save costs. It's going to be from insurance companies.
Robert, Representative Weiner has said before, and it's sort of stuck with me, he said, what value does a health insurance company bring a person? And I've never quite figured out that answer. Could you answer it for me today?
I would love to answer that, because I think this is a really important question that we need to be having. Health insurance companies have pioneered the types of programs that the American people want and need, the types of things that we're talking about expanding into Medicare because they work, doing care coordination so that patients with chronic conditions can get the care they need, doing pay for performance so that we're rewarding quality and value in our healthcare system, not simply paying for the number of services that are provided, promoting prevention and wellness, having the right incentives in our healthcare system. These are the types of things our industry has been doing.
If we were paying for value and service, wouldn't we be paying less and getting more?
We need to do more of it. A lot of these programs are beginning or underway, but we need to be working collaboratively across the healthcare system. And that's one of the things that we've been talking about. As we approach comprehensive healthcare reform, we need to be doing more in the legislation so that we're really getting at the underlying medical cost drivers, that we're really attacking these issues from across the healthcare system, not simply focusing on Medicare. There's a lot more that we can do in the area of cost and improving quality.
But you don't think price fixing is an issue at all in the health insurance industry?
It doesn't happen. And all the legal analysts, the Congressional Research Center, have said that McCarran-Ferguson has nothing to do with price fixing, has nothing to do with the issue of competition. It's a very, very limited exemption that really focuses and reaffirms that the states are the primary regulators of insurance. All state regulations still apply. There is no exemption from regulation across the board.
Representative Weiner?
Well, I let the record show that he didn't answer the question, what it is the insurance companies do. It seemed like every one of the examples is an instance where they're trying to maximize the money they take in, limit the amount they give out. Yeah, that's what businesses do, and I don't hold it against them. The question is, what value are they bringing to the proposition for us? They're about 30% profits and overhead. I'll ask a very simple question. You know, Robert, right now, someone is paying his salary. He's doing an admirable job because the insurance industry hires lobbyists. They hire public relations people. Medicare has a 3% overhead, and they actually do the same exact thing. They take our money, give it to doctors and hospitals. The insurance companies are where the money is. That's why they're fighting so hard to protect the status quo.
And on that note, Representative Weiner, we look forward to see what the Senate's going to do. Robert Zirkelbeck, I certainly appreciate your coming on the air.
Thank you.
Always good to see you. Representative Weiner, you too. Well,